Robin Hood Radio presents Your Health with osteopathic physician Dr. Kim Tripp, a show presented monthly on Robin Hood Radio, discussing the challenges faced and the solutions that are available for keeping vital health and well-being throughout our lives. And now, here's Dr. Tripp.
Hello, everyone. Welcome to Your Health with Dr. Kim Tripp, osteopathic physician. This is the health show created to bring you vital information and discussion of all sorts of health issues on your mind and in your life from the unique perspective of traditional osteopathic medicine. So first, let's clarify what osteopathic medicine means. Osteopathic medicine is practiced by fully licensed physicians in the U.S. with a DO degree, a Doctor of Osteopathic Medicine degree. Our practice is based on the essential relationship in all living things between structure and function. In other words, the natural interdependence between anatomy and physiology, or that between the physics of the body and its chemistry. As osteopathic physicians, we use our comprehensive and precisely detailed knowledge of anatomy and physiology to promote health and healing in our patients. We work gently with our hands to help your body restore optimal function based on optimal structure. Our medical specialty is therefore called osteopathic manual medicine. We receive uniquely in-depth training in anatomy and physiology and their relationship within your body in the context of a full physician's medical training. Only U.S.-trained osteopaths are fully licensed physicians and have all of the current medical pharmacopoeia, nutritional science, and full medical training at our disposal. This means that your individual treatment may include a wide range of approaches, but it will always be founded on our gentle hands-on work. We practice from the unique perspective of first looking for the health in our patients rather than merely finding illness and disease. Our practice has been especially effective for, but is not limited to, musculoskeletal and other structural issues, as well as problems like chronic headache, gastrointestinal disturbance, post-concussion syndrome, sleep problems, allergies, and many, many other health issues. We work together with you, the patient, to help you build health and vitality in your body, mind, and spirit as the solution for health problems, rather than only treating the disease symptoms. So in the radio show, we tackle health issues from this point of view. What can we do to help you build your health and vitality in order to prevent and heal injuries and disease? And we do that by giving you some basic information about the problem to help you understand what's happening, as well as offer solutions and guidance for helping yourself to heal and stay healthy based on our clinical experience with patients in our practice. Before we get started on today's topic, let me just remind you that you can listen to all of our prior Your Health shows online at your convenience, such as the shows on back pain, nutrition, carpal tunnel syndrome, concussion, etc., by going to Robin Hood Radio's website, then the on-demand section, and then scroll down and select the shows, or for all of them by going to the Goldman Tripp website, where there's a whole list of all the shows under the radio show banner. Today, we're going to begin by looking at the lungs and respiration in a series of shows. It's a very large topic, but at this extra busy and potentially stressful time of year, I think it's especially important to remember to breathe. So it's a really good time to think about respiratory health. We'll start with the relevant anatomy, as we always do, and there's a lot of it. So let's open up our mind's eyes as we breathe calmly in and out and picture some of the most amazing anatomy in the human body as follows. The anatomy of the lungs is a complex and fascinating subject, and we're going to devote the whole show today to just that. I think we all have an idea of what the lungs do for us, yet we rarely understand all of the important structure and function of the lungs, including in things like regulation of blood pressure, all of which we'll delve into in our full exploration of the lungs in other shows. But let's start with developing a picture of the anatomy of the lungs today. As most of us know, we have a pair of lungs that make it possible for us to breathe. Breathing, or more formally, respiration, is the process of inhaling oxygenated air, which then transfers the oxygen to our blood, and exhaling deoxygenated air that contains the excess carbon dioxide that's delivered back to the lungs from the blood. The job of the lungs is to deliver oxygen to the blood and remove CO2 from the blood through breathing. The special proximity of tiny blood vessels, called capillaries, to the lungs' air sacs makes this possible. Oxygen, of course, is essential for all of our cells to live and function, and removal of excess CO2 is also essential for survival. The two large lungs flank the heart, one on each side, filling our chest inside the ribs. The right and left lungs have somewhat different shapes, and the shape of the lungs in general is a bit hard to describe, but both are coarsely cone-shaped with a broader, curving lower surface, called the base, i.e. the wider part of the cone, and a narrower, rounded upper surface, called the apex, the narrowest part of the cone. The apex of each lung is up above our collarbones. The base of each lung is down in the chest, contiguous with the upper surface of the diaphragm. The lungs are made up of spongy tissue surrounding tiny air-filled sacs called alveoli that are the terminal cul-de-sacs for our branching airways that descend from the nose and mouth, called the bronchi. Our airways carry fresh, oxygen-rich air down through the trachea, which is our main airway from our nose and mouth, and into the lungs via all the airway branches, called bronchi, during inhalation. They carry old, oxygen-depleted, CO2-rich air out of the lungs with exhalation. Together, both lungs weigh nearly 3 pounds and contain 400 to 500 million of those little air sacs called alveoli, and about 1,500 miles of branching airways. The total surface area of the lungs ranges from about 600 to 800 square feet, about the size of half of a tennis court. That's a lot of lung. The lung tissue is divided into lobes, 2 in the left lung and 3 in the right lung. Both lungs have to make space for the heart, which lives in between them. The left lung has to make more room than the right lung because about 2/3 of the heart sits on the left side of the chest versus the right side. The right lung also has to make space for that very large liver, which rests just underneath the diaphragm below the right lung. So the right lung is a bit shorter and broader than the left lung. This results in significant differences in the architecture of the left lung versus the right lung, including the difference in the number of lobes. This is, by the way, an example of the fact that there is almost no absolute symmetry in living systems of any kind. In spite of the fact that we have paired parts, they are rarely identical. The lungs are covered in 2 membranous layers called the pleura. The pleura are 2 very thin layers of tissue that protect and cushion the lungs. The inner pleural layer is called the visceral pleura because it is closest to the lung organs themselves, and viscera means organs. The inner visceral layer wraps around the lungs and is adhered so tightly to them that it cannot be peeled off. The outer pleural layer is called the parietal pleura because it is closer to the chest wall, and parietal means relating to or attached to the wall of the body or of a body cavity. The parietal pleura lines the inside of the chest wall. The narrow space between these 2 pleural layers is called, logically enough, the pleural cavity. The pleural cavity is filled with a liquid called, again logically enough, the pleural fluid. The pleural fluid lubricates the pleural cavity so that the 2 layers of pleural tissue can slide and glide over each other easily and facilitate the expansion and contraction motions of the lungs during breathing. Think of the pleura as 2 layers of plastic wrap surrounding the lungs with a layer of juice in between them. all surrounding the lungs themselves. It's important to know about the pleura as they can become inflamed, leading to a problem called pleuritis. Just outside the lungs are the bony ribs of our chest. In between the lungs and the ribs are layers of muscles that assist with the motions of breathing, and we'll get more into those later. The heart rests between the lungs, surrounded by its own set of membranous layers. The heart and lungs are connected by some of the large vessels that carry blood to and from the lungs. There is blood that is returned from the heart to the lungs to be oxygenated, and the newly oxygenated blood from the lungs is then returned to the heart to be pumped out into the body. We'll delve more into this relationship in the next show. Meanwhile, the branching airways run throughout the spongy lung tissue where they can come into contact with the little capillaries that are delivering blood to the lungs for reoxygenation or receiving oxygenated blood for redistribution to the body. Again, all via the heart. Let's look at those branching airways in a little more detail. During breathing, air comes and goes into and out of the body through our mouth and nose. When we inhale, the air is carried into the back of our throat into a region called the pharynx. The pharynx connects to a single large main windpipe called the trachea. The trachea travels down our throat to the lungs. The trachea then branches into two main airways called bronchi, one each headed either into the right or the left lung. Behind the trachea sits the esophagus, which is our food tube that carries chewed food from the back of the throat down to the stomach when we swallow. At the top of the esophagus is a little valve called the epiglottis, which closes when we swallow and opens after we swallow when we inhale to keep us from inhaling our food into our lungs. The trachea and bronchi, or airway pipes, are held open by rings of cartilage embedded in the walls of these airways to prevent collapse, kind of like reinforced hoses. These main bronchi then branch further within each lung into smaller bronchi, which then branch again into even smaller bronchi. This serial branching continues for about 6 orders of magnitude, like the increasingly smaller and smaller branches or roots of a tree, until those bronchi are eventually too small to contain the supportive internal cartilage, at which point they are called bronchioles. These smallest airway branches at the ends of these serial dividing branches end in those little air sacs called alveoli. Remember those? The alveoli sit like clusters of grapes, or like little balloons, at the ends of the tiny bronchiole airways, and the alveolar sacs are separated from each other by tiny elastic membranes, again like little balloons. Surrounding these alveoli are networks of tiny blood vessels called capillaries. These tiny blood vessels allow for direct gas exchange between the blood and the alveoli. This means that carbon dioxide can be released from the deoxygenated blood that has been returned by the capillaries and pass into the alveoli. And this CO2 can then be exhaled from the little alveoli air sacs through the airways and out of our nose or mouth. Then, as we inhale new, fresh, oxygenated air through our nose and airways and down into the alveoli, the blood inside the capillaries can then absorb new oxygen from the alveoli from the fresh air just inhaled into the lungs. This oxygenated blood can then be delivered to the heart and then pumped out into the body. The alveoli are each about 200 micrometers in diameter, which is about 7 to 8 thousandths of an inch. The numbers and sizes of alveoli are variable based on lung size and age. Lungs are larger in adults than in children, and are generally larger in men than women, depending on the overall body size. Taller, larger women can have lungs similar in size and capacity to shorter, smaller men. It's all incredibly astounding. But let's take a step back now and review the anatomical relationship between the heart, lungs, and diaphragm to set us up for the next show, where we'll talk about lung function and how it all works together. Recall that the heart and lungs rest on top of the diaphragm with the heart between the two lungs. The heart and lungs are connected to the diaphragm through the thin, pliable membranes that surround all of these structures. So they function as an integral entity. They are not just floating in space like the diagrams on the web. Large arteries and veins run into and out of the heart and lungs, connecting them to each other, so that the lungs can deliver oxygenated blood to the heart to be pumped out into the brain and body, and also so that the lungs can receive deoxygenated blood that is returned to the heart from the veins to be reoxygenated as we breathe. Each time the heart beats in a full cycle, oxygenated blood flows from the lungs to the heart and out into the body, and deoxygenated blood flows from the heart into the lungs to release CO2 to be exhaled and then be reoxygenated by our inhaled air. The diaphragm upon which the heart and lungs rest makes it possible for us to inhale when it contracts and slides downwards, making more space in the chest cavity. This process alters the internal pressure inside the chest cavity relative to the external pressure outside the body. This change makes it possible for outside air to more easily flow into the airways and all the way down into all the little alveoli air sacs. Then, when the diaphragm relaxes and slides upwards again, we exhale. There are also a number of muscles in the chest that assist with this process, and all of it is coordinated by our central and autonomic nervous systems. We'll explore this process in more detail in future shows, but this gives you a picture of the exquisite beauty and complexity of the lungs and associated anatomy. The structure and function of all of these respiratory organs and tissues is clearly key to vital respiration and thus to remaining alive and healthy. Which brings me back to osteopathy and to the close of today's show with a reminder that a good osteopathic physician who is a specialist in osteopathic manual medicine can be especially helpful for respiratory issues of all kinds. Working gently with our hands with the involved organs, nerves, vasculature, fascias, capsules, and associated tissues to release restrictions in the physical structure and function and tissues of the lungs, airways, and diaphragm, and blood and lymphatic flow, as well as to help balance the autonomic nervous system function based on anatomical detail, and to help with nutritional issues and support for whatever procedures you may be going through. Recall that all of the respiratory system is a complex physical entity with connections between all the parts that need to be open, flexible, and moving freely with excellent neural conduction from the nerves, optimal arterial and venous blood flow, and lymphatic drainage to remain healthy, vital, and functioning normally. Well, I seem to have run out of time again, which is probably just as well because that was pretty complicated. Thank you so much for your attention to Your Health with Dr. Kim Tripp. Remember, you can email your comments and suggestions for topics to yourhealth@robinhoodradio.com. If you have a health issue yourself and would like to find out about how we might be able to help you in our practice of traditional osteopathy, we are at our offices in Sharon, Connecticut. Dr. Kim Tripp and Dr. Andrew Goldman, Goldman Tripp Osteopathic Healthcare, 860-364-5990. Monday to Friday, 8:45 a.m. to 5 p.m. with evening hours, Wednesdays and Fridays, or on the web at www.goldmantripp.net. I'll be looking forward to being with you next time. Meanwhile, you take care of yourself, don't forget to breathe, and thank you for listening.